my name is Tabby Phillips. I'm going to be your nurse today. Can you go ahead and please give me your name and your birthday so I can verify that with your armband?
Amy Belt, 12183.
Very good. And I do want you to know I just washed my hands before I came into your room. Can you please tell me where you are today?
Memorial Hospital.
Memorial Hospital. And what is the date?
December 7th, 2014.
Very good. So you are alert and oriented ×3. Today what we're going to do is a head-to-toe assessment, and I'm basically just going to be checking you out all over, okay? I'm first going to start with skin assessment. I'm looking at your skin from head to toe, your abdomen, your arms, your chest, and your back. Very good. Looking at your legs and your feet, and I'm looking for any kind of skin lesions, any excessive dryness or scarring or open wounds, anything that would be abnormal, then I would chart that. Next, I'm going to assess by feeling the temperature of your skin with the back of my hand, the dorsum. I'm just looking to see if your skin is cool or clammy or diaphoretic. Everything feels normal. Okay. And if also, during this assessment, if you have any questions, please do not hesitate to interrupt and ask. I want you to be comfortable. Okay. Next, what I'm going to do is check the turgor of your skin. And I'm going to pinch just a little bit up on your clavicle, and we want to see it return back to its baseline immediately, and it has. So it doesn't look like we have any abnormality there or dehydration. I'm going to put on my gloves for the rest of the assessment, if that's okay with you. Okay. Next, what we're going to do is I'm going to check your nodes, your lymphatic nodes, okay? So we're going to start with your head, and when we do this, we really want to get a good pattern, kind of a rotating way to check it, to assess. And I'm looking, and I want the lobes, the nodes, excuse me, they should be movable and they should not have any pain. This time of year, everyone has some swollen nodes in this neck area. No pain with any of that. Everything felt really movable. The next node is I'm going to check in your axillary, which is underarm, and I hope it won't be ticklish. Okay. Sorry. Just same thing, looking for anything that feels abnormal. Everything's movable. Great. We'll check this side as well. Very good. Okay. Any pain with any of that?
No.
Very good. Okay. After that, what we're going to do is I'm going to check your ear. And we're looking at your tympanic membrane, otherwise known as the eardrum. And I want it to look pink and shiny and smooth. Very good. I don't want any red bulging. Very nice. I don't want any red or bulging eardrum. Any kind of drainage would not be normal at all. Okay. Next, what I'm going to do is check Perla. This is your pupils. They're equal, round, and reactive to light and accommodation. And so I'm going to shine a light into your pupil. I'm going to watch your pupil change, minimize. Very good. And it should be round and reactive, and it is. Next, I want you to follow my finger, looking at your eye muscles. Very good. Nice. Nothing abnormal with that, okay? And then now I'm going to look at your mucous membranes under your eye. Good. Look at each eye. We're looking at the conjunctiva. I always say that word incorrectly. Looking for pink and moistness, which it is. I'm going to look in your mouth. Whoops, light's the wrong way. Very good. Everything is moist. The tongue is a even pale pink color. And looking under the lips. I know it. Okay. Very good. So there's no dryness there. I didn't see any cracking on the tongue or any kind of mouth ulcers. Okay. Next, what I'm going to do is check your pulses. Okay. I'm going to start with your radial pulse. And we want to check those at the same time. We want the same rhythm, same strength on both arms. When you check a radial pulse, you check it for 30 seconds times 2 if the rhythm is regular. If it's not, if it's irregular, we check for 1 full minute. She has a regular pulse on both. We're going to come down to the feet. Check the dorsalis pedis. That is on top. Once again, looking for bilateral strength and rhythm on both. We would, if a patient had a light pulse or rate, we would chart that as thready. If it's strong, we would chart that as bounding. This is also where we're going to check for edema in the tibial area. When we check for edema, we're going to press and hold for 5 seconds. 1, 2, 3, 4, 5. We have no pitting edema, but if we did and the skin stayed pressed in where I held it, you would chart that as a +1, +2, or a +3. She has no edema here. All right. Next, what we are going to do is I'm going to check cardiovascular. I'm going to listen to your heart rate. We have a pattern that we follow when we listen. It's like a Z pattern. I'm going to let you know of each area. Before I do start, I'm going to listen on the way down with my diaphragm, on the way back up with the bell side. Okay, listening for your heart rate, if it's regular or irregular, listening for any additional sounds. Before I do start, I want to look at your chest. Very important here. I want to see if I see any kind of pulsations, any lifts or heaves. That would definitely let me know of an abnormality with the heart. Okay, but I do not see any of those at all. We're going to start. I'm going to start on the right side of the chest with the diagram. On the second intercostal space, this is the aortic area. Crossover, still a second intercostal on the left side. This is our pulmonic area. Listening to heart rate, go down to the third intercostal space, still on the left side. This is Erb's point. You would go under the shirt, the fourth and the fifth place. Not going to show anything. This is both the tricuspid area. We're still on the fifth intercostal. We're just going to go over here to the left mid-clavicular line. This is where our apical pulse is. And here we're going to get our heart rate. Great place. This is where heartbeat is heard loudest. And we'll listen for 1 full minute. Normal heart rate would be between 60 to 100. Additionally, we're going to listen back up with the bell. So going back up, apical spot, place. Back over here to fifth intercostal. And again, fourth. Oops, sorry, it's okay. That's the tricuspid area. Third intercostal space. We're still on the left side is the Erb's point. Second intercostal place is pulmonic area. And back over to the right side, still second intercostal is aortic. Alrighty, do you have any questions so far?
No.
Everything is very normal. You seem very healthy at this. Everything is within range. Wonderful. Anything that is abnormal, we would immediately chart it. If it's emergent, we would let the doctor know as soon as possible. Okay, so that's our cardiac assessment on that. What we're going to do before we're going to listen to abdomen before I lay you back is, can you hold both of my hands, and I want you just to grip them at the same time. You want to make sure the grip is the same in both feet, both hands, and it is bilaterally. Equal in strength. Same with the feet. What I want you to do is pull your toes towards you. Good. And then push your feet down. Good. And it would be important because if there's strength on one side and not the other, we would definitely chart that and let the doctor know about that. Okay, next what we're going to do is abdominal assessment. And I'm going to lay you supine. Okay, lay you back. It's easier to check the abdomen that way. Abdominal. Okay. Sorry, I don't have a pillow for you. There we go. I'll lift you up. I'm going to save the back. Okay, before I start, I'm going to look at your abdomen, assessing skin as well. Looking to see if your abdomen is symmetrical, any kind of additional movements or thrills. I see no thrill. That could be an important abnormality we'd want to assess further. What I'm going to do is listen to your abdomen. We have 4 quadrants. I'm going to start in the right upper quadrant, and I'm going to go clockwise. I'm hoping a normal bowel sound would be 3 to 5 bowel sounds per minute in each quadrant. If I were in a quadrant and listened for a full minute and did not hear any bowel sounds, then I would listen for 5 full minutes after that. That could be a serious issue, an impaction or a blockage, additional things. We would let the doctor, that's emergent. Okay. So we're going to listen. Right upper quadrant. Listen for a minute. Left upper. And we go around like so. And I'm hearing sufficient bowel sounds in each quadrant. Very good. I did want to say, before you do start listening, you start your abdominal assessment again. You want the patient laying flat like you really want to stand and stoop over. You want to really visualize the abdomen. Okay, that's important. I'm going to do some light palpation. This is really just superficial palpation, and this just really lets me know if there's any guarding or tenderness. Do you have any pain or good? Very good. Next is going to be deep palpation. You just kind of do a rolling motion with it. Some people are ticklish, but what you're looking for is any kind of masses, any kind of organ megaly. Any pain with that? Very good. Okay. I'm going to sit you back up. We're almost finished. You were a great patient. Okay. So let the bed back down. Okay, what we're going to do now is I want to have you swing your legs over the side of the bed, and we're going to do listen to your respiratory. Come over on this side. I think this will be fun. All right. So, before I listen to my patient's lungs, I just simply want to assess their respirations. Normal respirations are between 12 and 20. And I'm just looking at her breathing. I'm watching her chest to see if it rises and falls, if it's symmetrical. And I can even place my hands on her. Take a good breath for me. And as I do that, I'm looking at my fingertips. You know, I don't want anything off balance. That could be a possible issue like a pneumothorax or any kind of atelectasis. And so we would definitely chart that, and that's in another emergent call to the doctor. Also, before I start, what I want to do is check her anterior-posterior measurement to her transverse. Transverse is chest across. We have anterior and posterior. So we're going to measure hers, okay? And we see that her anterior-posterior is less than her transverse, which is normal. If anterior-posterior was wider, we're looking at a patient that may be barrel-chested or would have COPD. She does not. Now what I'm going to do is listen to your breath sounds, okay? I'm going to listen to your anterior side, your posterior side, 6 to 10 places on each side, and then your one side on the right, which is lateral, okay? Listening for normal breath sounds. Any adventitious breath sounds would be, you know, any kind of crackles or wheezes, bronchi, anything like that, once again, would be abnormal. Okay. As we listen, we go back and forth to each side to compare. And I want you to take deep breaths, but I do not want you to become dizzy, so if you are, just let me know and we'll stop for a moment. Deep breath. You may want to make sure your stethoscope is on the skin. Okay, I'm going to cut under here just a little bit. Deep breath. Okay, here. Good. We're going to listen to our lateral side, right side. Very good. Are you feeling okay?
Mm-hmm.
We're going to do the same thing on the back. Okay. There we go. We can do this right above the shoulder. It actually starts up high. Deep breath. Very good. Right below the shoulder is what I meant. We don't want to be on the spine, right on the lateral part of it. Lateral side. Very good. I'm hearing very normal breath sounds. I don't hear any wheezing. Any abnormalities, no crackling. All right, I'm almost finished. Very good. It's a lot of breath, right?
Yeah.
Okay. Great. You feeling okay?
Mm-hmm.
Very good. Okay. So last but not least, what we're going to do is we're going to assess your spine. Okay. What I'm going to have you do is stand up and face this wall. There we go. I'm going to look at the spine first. Just palpating. See if there's any tenderness. Okay. Any abnormalities, once again, masses. I want you to lean over, as long as you're not very good. Still palpating. Do you feel any tenderness or pain?
No.
Okay. And I want you to lean just a little bit farther without falling. And we want to look at the curvature of the spine. Make sure that it is symmetrical on both sides. Thank you. And any abnormalities or differences that we would need to chart again, always, and let the doctor know of any emergent problems immediately. Thank you.